Let me bring Debbie in because she's been hanging on there. And as I say, Debbie, we've spoken to you before. You have this concern about your access to, I guess, specifically Poole Hospital because you live in Swanage and what that might mean for your COPD. Are you appeased at all by what you've read of these responses to the report?
No, I'm not at all appeased. And what I notice is that 75,500 people have signed petitions opposing the cuts, but that these haven't actually been given any weighting against something like 21,500 who've actually completed the questionnaire. And the idea that it's better for us to travel further, that's only against context of not having enough clinicians in each hospital. If the NHS had been properly funded, which it hasn't been since 2010, we wouldn't, and if there hadn't been a public sector pay freeze, junior doctors dispute, we wouldn't be in the position cutting of nurses' bursaries for training, introduction of tuition fees. We wouldn't be in a position where we are so short of staff that we haven't got enough.
It's funny, I was reading the document before we came on air, which has been released, and it's true what you say. I mean, they document the responses of people to the questionnaire, but they don't seem to document all the original objections, and yours is one of those. The fact that you live on the Purbex and you have this concern about how you're going to get to a Bournemouth A&E rather than a Poole A&E.
Well, I'd like to just cover, because really I haven't campaigned for me, although it's true that in the past I had a respiratory arrest. This is not the same as managing COPD. It means I stopped breathing. I lived in London at the time, and I was advised if it had taken me another 10 minutes to get to the A&E, I would have died. But I've actually been campaigning on behalf of people in Purbeck, and more than 8,000 people in Purbeck have signed by hand. So this is not a petition online. We've been around Corfe, Wareham and Swanage. We've been in shops, we've been on stalls, and we've been door to door, and we've collected more than 8,000 signatures against the downgrading of Poole A&E and the closure of Poole Maternity. And that represents nearly half the actual responses they've got to the questionnaire. That leaves aside Sean Perrin's Save Poole Hospital petition, which I think was about 25,000 people have signed that. So as throughout the whole thing, it's totally skewed what the CCG have done in favour of getting the responses that they want to cut the money that they've been told to cut by central government.
OK. Debbie, we'll leave it there for now. It's good to talk to you. Debbie Monkhouse there, Damien Stone before her, both campaigning about the NHS in Dorset. If you'd like to see the results of this clinical services review as they've been released so far, you can do that via the same website that you may have responded to the consultation on, which is dorsetsvision.nhs.uk. A couple of clicks will take you through to a pretty hefty PDF document where you can read the same results that we have. A final decision on these proposed changes will be made later this year, and of course we'll keep right across that story here on Breakfast in Dorset.
BBC Radio Solent
with Steve Harris.